Hey, it's Bill Simmons from the Bill Simmons Podcast here to tell you about Michelob Ultra Courtside. It's getting fans closer to the NBA with a chance to win prizes like courtside seats, a trip to All-Star Weekend, and much more. Check it out at MichelobUltra.com/courtside. Michelob Ultra Superior Access, Courtside 24-25 sweepstakes, no purchase necessary. Open to U.S. residents 21 and up. Begins on October 1st, 2024, ends July 1st, 2025. Multiple entry periods. Visit MichelobUltra.com/courtside for free entry deadlines, and official rules. Message and data rates may apply. Void where prohibited.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach nursing concepts and share tips so that you can thrive in nursing school and at the bedside. So today we are talking about pulmonary embolism, a pretty common condition, and hopefully not so common that you'll ever see it, but you definitely could. So it's important to be aware of the signs and symptoms and the key treatment so that you can act fast and do what is necessary to save your patient. Now, before we dive into that, let's take a quick minute for a listener shout out. And this one goes out to Amber, who says, "Thank you so much for helping me and my study group. Listening to you has helped me immerse myself in nursing and lose the grip on my desk. I've brought my test scores up from an 85 to a 98 because now I'm finding new and interesting ways to study, and I'm always encouraging my study group to listen in too. We appreciate you so much." Amber, thank you so much for sharing your experience with the podcast and how it's helped you study in different ways, get away from your desk, and bring up your test scores. I'm really proud of you and want to wish you all the best in your nursing career. Okay, so we're talking today about pulmonary embolism. So first, what is a pulmonary embolism? So this is a condition in which vessels in the lungs are blocked by a thrombus or some material that has traveled from somewhere else in the body. This is usually a result of a venous thromboembolism or a blood clot from the veins, but can also be due to amniotic fluid, air or fat embolus, or tumor material in patients with cancer. Now, a key thing to understand about pulmonary embolism is that the airway is not occluded. In pulmonary embolism, one or more blood vessels are occluded. So what this means is that blood coming from the right side of the heart is not able to pass freely through the pulmonary vasculature. And if it's not going through the pulmonary vasculature, it's not participating fully in gas exchange. And this negatively affects perfusion. So now you might be wondering, well, how serious is a pulmonary embolism? The short answer is pretty darn serious. Pulmonary embolism caused by a venous thromboembolism, or VTE, is a leading cause of preventable hospital death in the United States. This is why so much emphasis is placed on VTE prophylaxis in the clinical setting. And those prophylactic tactics include things like compression stockings, sequential compression devices or SCUDs, and anticoagulants. Now, I do have a whole episode about VTE prevention. So let me grab that episode number. That is episode number 59. So I will put a link to that episode in the show notes so that you can easily click right over to that. Now, here's what I want you to understand about pulmonary embolism is that left untreated, acute pulmonary embolism has a mortality rate as high as 30%. That's a very high mortality rate. And up to 10% of patients just die suddenly from the pulmonary embolism. However, in patients who don't die suddenly, with prompt treatments, mortality rates can be as low as 8%. So taking it from 30% down to 8%. And in order for patients to have the best possible outcome, it's absolutely vital that pulmonary embolism be recognized and treated very quickly. So, a key component of that is knowing who is at risk for pulmonary embolism. Whenever you can be thinking about the things that your patient is at risk for, you're not just writing a care plan like in nursing school, right? We write those things in our care plan. But as you're working at the bedside, knowing what they are at risk for amps up your surveillance for those things. It increases your index of suspicion when they start to show abnormal signs and symptoms. So, in most cases, your patient who is at high risk for pulmonary embolism is your patient who is at high risk for developing a venous thromboembolism because, again, most of the time the PE is a result of that venous thromboembolism. And so this is going to include patients who are immobile, patients who are, for example, on bed rest. It's also patients who have had recent surgery or some kind of trauma, especially to the vessels. We're looking at things like orthopedic surgeries, especially have high incidence, vascular surgeries, leg fractures, things like that. And individuals with hypercoagulability, such as patients taking estrogen or birth control pills, or patients with elevated platelet counts. So that was immobility, vascular trauma, and those with hypercoagulability. Okay? And it's important to note that even though a venous thromboembolism is the most common cause for a pulmonary embolism, it's not the only cause. Okay? So it could be from a fat embolism, which is something that occurs when fat from a long bone or a pelvic bone enters systemic circulation as a consequence of surgery or trauma. So fat embolism is one. Another is amniotic fluid embolism. And this occurs when amniotic fluid, fetal cells, or other debris enter maternal pulmonary circulation. And you can learn more about this complication of pregnancy in episode 252. You can also get a pulmonary embolism from tumor fragments. Though it's not common, tumor fragments or clusters of tumor cells can dislodge and travel to the pulmonary vasculature in patients who have solid tumor cancers. And then air embolism. This complication results when air is introduced into systemic circulation. Most often, this occurs during surgery. It can also occur during scuba diving, or with trauma, and with placement and removal of central venous catheters. And of course, I have an episode for that as well. That is episode number 338, if you want to learn more about air embolism. Okay, now let's talk a little bit about pulmonary embolism pathophysiology, and then we'll dive into all the key nursing assessments and interventions using the straight A nursing latte method. So first, a brief overview of pulmonary embolism pathophysiology. So when a thrombus occludes pulmonary circulation, catecholamines and inflammatory mediators are released. And these neurohormonal substances cause vasoconstriction in the pulmonary vasculature. And what this does is it further impedes blood flow in that lung. So this vasoconstriction also increases pulmonary pressure, which causes the right side of the heart to have to work harder. Remember, you have to think about that blood flow pathway. It's coming from the right side of the heart into the lung. That right ventricle is the one that is squeezing and forcing that blood up through the pulmonary artery into the lung. So if there's a lot of high pressures in the pulmonary vasculature, the right side of the heart has to work harder. And what do you think happens to the heart when it has to work harder? This can lead to heart failure and reduced cardiac output. Now, when a portion of the lung does not get blood flow, this leads to damaged lung tissue and a loss of surfactant. And the ultimate result is a VQ mismatch. This is also known as a ventilation perfusion mismatch, and I realize that's confusing. The V part makes sense, but the Q is a little confusing. So it's VQ, which stands for ventilation perfusion. And the short explanation of this is that when a patient has ventilation, but inadequate perfusion, there's a mismatch. And this is a type of VQ mismatch called a dead space mismatch. The air is getting to the alveoli, but the alveoli are not able to participate in gas exchange due to the presence of that thrombus, which is, of course, impeding that blood flow. Now, if you want to take a deep dive into VQ mismatches, guess what? I have an episode for that as well. It is an oldie. It is episode 46. So if you want to understand this a little more deeply, go and check that out. Now, overall, the patient experiencing a pulmonary embolism can have significant hypoxia, reduced cardiac output, and cardiac dysrhythmias. And in severe cases, they can go into shock, which has a very high mortality rate. All right, so now you've got some background. It's time to dive into all the nursing-related things, and we will do that with the Straight A Nursing Latte method. So we start with the letter L, which stands for look. How does the patient look? Basically, what are their signs and symptoms? So a patient experiencing a pulmonary embolism is likely to have these key signs and symptoms. One is shortness of breath. Definitely can be very significant. And with that, you'll see a dropping SpO2, a dropping oxygen saturation level. The patient will also have increased work of breathing. They could have chest pain upon inspiration and feel some chest pressure. They could have a cough, and this could have some blood-tinged sputum associated with that. They definitely are going to feel some anxiety, and something that seems to always show up on exams is a feeling of impending doom. And I will say, having been a nurse for a while now, if your patient tells you they feel like they're going to die, you need to listen, because that feeling of impending doom is very, very real, and it can accompany a pulmonary embolism. So the next letter in the latte method is the letter A. Let's dive into that after we take a quick break.
When your gut feels off, your whole day can feel off. Activia probiotic yogurts and dailies are a quick, easy, and tasty way to up your gut health game every day. They're deliciously smooth and creamy and packed with billions of live and active probiotics. Your gut is where it all begins, so start with Activia. Enjoying Activia twice a day for 2 weeks as part of a balanced diet and healthy lifestyle can help reduce the frequency of minor digestive discomfort.
So the letter A in the latte method stands for assess. Basically, what are we going to do to assess our patient? So you want to get a set of vital signs. And what you're likely to see here is a low SpO2, tachypnea, hypotension if that heart is starting to have some difficulties, and tachycardia. Probably the first sign you're going to see, though, is that low SpO2 and the tachypnea. You also want to assess work of breathing and basically how hard is your patient having to work. This can give you some clues as to how severe that pulmonary embolism is. And you're also looking for signs of air hunger, such as gasping or even grunting. And if you see these signs of air hunger, they are signs of pretty significant respiratory distress. Your patient is well on their way to respiratory failure, and you've got to act fast. You want to listen to the lungs. Now, what you might hear are coarse lung sounds. You could also hear a pleuritic friction rub, which can occur in pulmonary embolism. And while you've got your stethoscope out, listen to the heart sounds as well. You could hear S3 and S4 in patients who are severely compromised. Take a look at your patient. Look for signs of cyanosis, which is that bluish discoloration to the skin. Note that in darker skinned individuals, it's going to maybe appear more grayish or more pale. And I do actually have a whole episode about looking at alterations in skin signs in darker skinned individuals. And that is episode 349. Now, you also want to assess your patient for confusion or decreased level of consciousness. And this occurs when the brain is not getting adequately perfused. Basically, brain's not getting enough oxygen. You can also assess the skin for petechiae, which are small reddish little dots under the skin. And if present, these generally occur on the chest and the axilla. And when they are present with a pulmonary embolism, it's likely to be a pulmonary embolism due to a fat embolism. And you also want to monitor for signs of bleeding because, as you will hear in just a moment, the treatments for pulmonary embolism are going to put the patient at high risk for bleeding. Alrighty, the next letter in the latte method is a T, and that is for tests. What tests will be utilized to confirm the diagnosis or evaluate a patient with pulmonary embolism? So a key test is an ABG, or an arterial blood gas, and this will show low oxygen levels and initially a low carbon dioxide level due to hyperventilation. But as the condition progresses, the CO2 level will rise, leading to respiratory acidosis. Another test is the D-dimer. In the case of a blood clot, the D-dimer will be elevated. This indicates the release of fibrin degradation products that occur in response to clot formation. Also, a chest x-ray. Now, the great thing about a chest x-ray, it's a really fast imaging study, and it can identify pulmonary embolism. The downside is it's probably not going to show smaller embolisms. It's likely only going to show big ones. A chest CT scan is relatively quick and one of the most commonly utilized diagnostic exams for patients suspected of having a pulmonary embolism. Another test is a VQ scan. Now, you learned just a moment ago what VQ meant. It's a ventilation perfusion scan. And this test looks at the circulation of blood in the pulmonary vasculature. Now, this test is highly effective in diagnosing pulmonary embolism, but it does take much longer to perform than a CT scan. And from my experience, patients who are short of breath for any reason kind of have a hard time with this exam because they have to lie flat or mostly flat for a good period of time, which can be very difficult when shortness of breath is a problem. Another test that could be utilized is pulmonary angiography. This exam is highly diagnostic for pulmonary embolism, but it's invasive and it's expensive. In this exam, the physician inserts a long, very thin catheter through a vessel and advances it all the way into the pulmonary artery. They then inject dye through that catheter, which enables the physician to take X-ray images that can reveal any blockages in that pulmonary vasculature. Other imaging studies include ultrasound or MRI, and these can be used to locate the embolism, especially when CT scan is not available. And then a 12-lead EKG is going to be conducted on your patient and will typically reveal tachycardia and could also show something called the S1 Q3 T3 pattern. That's S1 Q3 T3 pattern. So this is a large S wave in lead 1, along with a Q wave in lead 3, and an inverted T wave in lead 3. So if you see this pattern, it is indicative of strain on the right side of the heart, which, remember, that right side of the heart is the side that's working extra hard to overcome the pulmonary hypertension that is occurring from the pulmonary embolism. Coagulation studies will be drawn prior to initiating thrombolytic treatment and then again regularly throughout therapy. And fibrinogen could also be done. If the patient is receiving TPA, they will need fibrinogen evaluated routinely. And then one more is BNP. In cases where heart failure is suspected, which it could occur in a larger pulmonary embolism, blood will be drawn to test the level of brain natriuretic peptide, and it will be elevated in heart failure. All right, so we've gone through how they look, how you assess them, what tests are likely to be ordered. Now it's time for the second T in the latte method, and that is for treatments. What are we going to do about this patient? So initially, the very first things you want to do, let's say you're in the room and the patient says, I can't catch my breath, I'm having trouble breathing. And you look on the monitor and they're suddenly 82% on room air and they have their hand on their chest. Well, I'm going to be concerned they're having a cardiac event or some kind of respiratory event. Whatever it is, I am placing that patient in high Fowler's position and supplying supplemental oxygen per protocol. Now, another key treatment is actually going to do something about that clot, and that is thrombolytic therapy. And thrombolytics are medications used to break up an existing clot. And the medication we use is TPA. It is a thrombolytic. When you think of the word lytic or lysis, think of something breaking something up. We're breaking up the clot. Now, in contrast to that, the patient could also get anticoagulants. Anticoagulants aren't going to break up an existing clot, but they're going to help prevent new clots from forming. So, in general, as I was doing my research for this article, generally, if the patient's getting, say, heparin, which is the common anticoagulant, that will likely be stopped while the thrombolytic is infusing and then started again after the thrombolytic is utilized. In some cases, you could see both used simultaneously. Just know that you're going to probably see these medications either alone or in combination together. Now, patients may also need long-term oral anticoagulation. So in the hospital, in the clinical setting, the patient you're taking care of there that had a PE is going to be on a heparin infusion. And then they may transition over to heparin injections or enoxaparin injections, but at some point they're going to go home from the hospital and most likely not taking an injectable. They could take enoxaparin. People do take it at home and self-inject at home, but a lot of times they get an oral anticoagulant. This could be warfarin, though I see a lot less warfarin these days and a lot more use of direct oral anticoagulants or DOAC medications such as apixaban, which goes by the brand name Eliquis. Now, another treatment that is not pharmacological is an IVC filter. Patients who are at high risk for pulmonary embolism due to venous thromboembolism may get an inferior vena cava filter placed. Now, this filter essentially catches and breaks up any emboli as they travel from the deep veins of the lower body up through the vena cava. So recently I was teaching clinical and one of my students had a patient who had venous thromboemboli. Is that the plural for venous thromboembolisms? Because they were in either leg. He had one in each leg. So very, very high risk here for pulmonary embolism. But he was having a GI bleed. So this patient could not get an anticoagulant like heparin because that's just going to make his GI bleed worse. So he got an IVC filter placed. Now, another procedure that could be utilized for pulmonary embolism is an embolectomy. So what does ectomy mean? It means removal. So you can probably piece together that this means removal of the embolus, embolectomy. So larger clots may require this as a way to remove them. It is a surgical procedure that removes the clot. And then other treatments could be, let's say you have a patient who has reduced cardiac output. They may get fluids. They may get inotropic medications such as dobutamine or milrinone, and others may need vasodilators to combat pulmonary hypertension. So those are the key treatments. Sitting the patient up in high Fowlers, put some oxygen on them, get some help. Patients likely to get thrombolytics to break up the clot and anticoagulants to prevent future clots from forming. They could get an IVC filter, and if the clot's really big, an embolectomy. And then other treatments would be to support reduced cardiac output. That could be fluids, inotropic medications, and then a patient who has high pulmonary hypertension could get a vasodilator. All right, the final element in the latte method is an E, and that stands for education. How are we going to educate our patients or their families about pulmonary embolism? So a lot of your teaching about this is for your patient who is receiving anticoagulation. So you want to teach the patient or the family or the caregiver about bleeding precautions because guess what? you're on an anticoagulant, you're going to be super bleedy. So we don't want them to hurt themselves or cut themselves. So let's teach some bleeding precautions. This could be shaving with an electric razor instead of a standard razor. And if they're going to be cooking, being very, very careful with sharp instruments like knives, or if they're a crafter and they're sewing, be very, very careful with your scissors, all those kinds of things to take extra precaution and extra care. They will also likely be advised to avoid activities that put them at high risk for falls or injury, such as contact sports. If you've got someone who's now taking Eliquis because they've had a pulmonary embolism, they're probably not going to be playing rugby anymore, okay? They might even be advised not to cycle because you fall off your bike, you hit your head, that could be devastating. So speaking of head injuries, you want to teach the patient to seek medical attention with any head injury. Anytime they fall, hit their head, stand up from unloading the dishwasher, hit their head on the counter or the cabinet, any kind of head injury, they need to seek medical attention due to the heightened risk for bleeding, internal bleeding in the brain. You also want to ensure the patient understands that they may bruise very easily and that they should monitor this. And if they notice any increased bruising, they need to report this to their physician, as it could indicate they have been overly anticoagulated. You also want to have the patient or caregiver teach back, so explain to you how they will take their medications and any labs that need to be routinely monitored, such as with warfarin, patients need to have their INR monitored. And if the patient is taking warfarin, teach them that they will need to either completely avoid foods high in vitamin K or have a consistent amount of foods high in vitamin K, like a daily spinach salad. The most common sources are leafy greens, like I just mentioned, like spinach or kale or things like that. And the vitamin K in these leafy greens can counteract the anticoagulant effect of the medication. So they either need to avoid it altogether or just have a consistent amount each and every day. And then another key thing to teach is that patients who have blood clots are basically at risk for having more blood clots. There's something going on that makes them hypercoagulable and prone to develop clots. So they should be instructed to seek medical attention if any symptoms of a blood clot start to show themselves or if they have any signs of pulmonary embolism. In addition, they should regularly check their extremities so that they can look for any areas of hardness or swelling or pain, which are indicators that a clot is forming. So there you have it, your quick overview about pulmonary embolism. I hope that was helpful for you and that you have some basic understanding of this condition so that you can feel confident if it happens to you in the clinical setting or if you encounter it on an exam if you're a student. And I just want to thank you for spending your free time with me today. It means the absolute world to me, and I'm thrilled to be here in 2025 still talking with you about nursing-related concepts. Some upcoming topics I have planned for the podcast are doing a breakdown, like a quick overview of the different types of schizophrenia, which can be sometimes difficult to differentiate, and looking at neutropenia and what neutropenic precautions entail. So I will see you back here very soon for more of the Straight A Nursing Podcast. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
It's the most wonderful time of the year. Minky Couture's holiday season is here. Wrap your loved ones in the gift of luxury with our softest, coziest blankets ever. Perfect for movie nights, chilly mornings, or those magical Christmas Eve moments. From kids to grandparents, there's a Minky for everyone. Shop our exclusive holiday collection now, in-store or online at minkycouture.com. But hurry, Santa's favorites won't last long. Minky Couture, making your holidays merry, bright, and oh so cozy.